Hello everyone, my name is Alexis Daniel, and this is my communication practice activity. For this assignment, I chose to use statement number 11, in which the patient in the hospital says to their rehab worker, "I know Dr. Brown is a very skilled surgeon, and he tells me not to worry, that there's very little risk in this surgery. I know I should feel reassured, but to tell you the truth, I am just plain panic-stricken." If I was the social worker in this scenario, I would respond with something like, "So it sounds like you are struggling with whether or not your fear is valid and what you should do to counteract it. I want you to know that your response to this situation is very normal and that most people feel scared before a medical procedure." This would be considered a level 4 response. This response correctly restates the emotions the client was trying to portray, but does not place additional meaning on the statements aside from what the client has explicitly disclosed. In my opinion, summarization is the easiest part of empathetic listening. I really enjoy this technique because it builds confidence in both the client and social worker, because the client can feel confident that their social worker is truly listening to them when their social worker restates what they have just said, and the social worker can feel secure in their interpretation of what the client is saying. The most difficult part of empathetic or active listening that we have learned so far, for me, is the proper use of furthering verbal comments. I find it a bit difficult to know when to use these in conversations while still maintaining authenticity. I can practice and improve this skill within the classroom as well as in my personal life. As we continue to learn textbook techniques for effective communication, I have practiced these skills in my day-to-day life with conversations with my friends and family to build up some practice using them naturally in a conversation before practicum next year.